Hello, everyone. This is Nora with rotational monofeeding. I just finished an article about a very common affliction in dogs, and it is pancreatitis. And I thought I would make a video just reading through the article and embellishing where I think it might be appropriate, because I know a lot of people like to listen to gather information instead of reading. So it's quite a long article. I don't know how long this video is going to be, but I will just begin. The article is entitled "The Truth About Pancreatitis in Dogs." Pretty much my first introduction to pancreatitis in dogs was about 20 years ago when I got a call from my sister about her 2-year-old Pomeranian named Rhodey, who had pancreatitis and was having to spend a night in the ER. My sister had found out that it was going to cost her $1,000. And of course, Rhodey was suffering and she was very worried about him. And so she wanted to avoid a recurrence. And at that time, I was just developing what would later become rotational monofeeding. So I had already identified that dietary fat in the diets of domestic dogs is what causes most of their problems, including pancreatitis. So, of course, the diet that I recommended to her was naturally low in fat. But my sister followed the instructions, and Rhodey never got sick again with pancreatitis. A couple of times over the next 14 years, he did have bouts with appetite loss, but a day or a little bit more of fasting always brought him back to normal. And he did not visit the vet once in the remaining 14 years of his life. So that's what I call success, when a dog stays away from the vet's office. And many years later, I had another encounter with pancreatitis that had a very sad outcome. It was a dog named Poncho, an 8-year-old golden retriever who I had taken care of since he was 1. And his owners were traveling and he was showing some symptoms of pancreatitis. So we decided that I would take him to the vet. And I did that. And the owner is a surgeon. So he sort of intervened and requested that the vet administer an injectable antibiotic. And they injected Poncho with a drug called Convenia. It's an antibiotic. And then after she did that, the vet confided to me that she would not normally have done that. She would not normally have given an antibiotic for a suspected case of pancreatitis. She'd only done that because the owner requested it, which I thought was a little crazy, because she should know her business better than any dog owner, even if the dog owner is a surgeon. So Poncho recovered that time, but a couple months later, he was again showing the same symptoms, and the owners travel a lot, so he was again in my care. And we just held tight until he stopped drinking on his own. And then we decided, in order to prevent dehydration, that I would take him into the vet again. And I instructed them to administer sub-Q fluids and to run some diagnostics. Unfortunately, the vet, seeing their request for Convenia on Poncho's chart, administered it to him once again, and this time Poncho collapsed into a coma. 2 hours later, he was carried unconscious to my car, and the owners, who had just arrived home from their trip, had to go straight that evening to an after-hours clinic and have Poncho euthanized because he was still comatose. So it was very, very sad outcome. He had been lethargic and a bit dehydrated, possibly when we walked into the clinic that afternoon, but he was ambulatory and certainly not near death. And I very strongly suspect that Convenia killed him. And I learned after that that many other dogs and cats have died after getting this drug. The vet in question later offered to take the Convenia shot off the bill for me, which I thought was kind of insulting. And she then later left that practice within, I would say, a few months. I don't really recall, but She now calls herself holistic. She's still practicing, but she calls herself holistic. So I don't know if the two events are related, but I suspect they are. So I'm not sure how much of the medical world people realize who are watching this, what goes on in the medical world. But when there's a bad outcome, the disease is always blamed. And when there's a good outcome, the drugs are always credited. So if death certificates were done on dogs, I have no doubt that pancreatitis would be on Ponchos, and he was absolutely not killed by pancreatitis. He was killed by convenia. So what does the pancreas do? To understand the causes of pancreatitis, we first have to know what the pancreas is tasked with in the body. The VCA website, the VCA is a sort of conglomerate of many veterinary hospitals, I think 1,000 hospitals, animal hospitals across the United States and Canada. That website tells us that the pancreas produces enzymes to assist in food digestion and hormones such as insulin, which regulates blood sugar or glucose metabolism. And these digestive enzymes are then secreted into the small intestine, and subsequently, they are ushered into the bloodstream. Through various processes, they allow the body to make use of glucose or sugar. What is pancreatitis? Well, the suffix itis simply means inflammation. So wherever you see itis on the end of any word, it means inflammation of that organ that is being referred to in this case. Inflammation of the pancreas. Inflammation has long been the perceived nemesis of the medical profession. Doctors and vets view it as a mistake made by the body that needs correcting with drugs. Typically, they blame microorganisms for invading the organ or tissue involved, and the inflammation is thought to be the body's attempt to rid itself of the invaders. That's why in most cases of inflammation, some drug or remedy aimed at killing or neutralizing bacteria is administered. But inflammation, wherever it might occur, is absolutely not caused by any microorganism invading a dog's body. It is the body's own intelligent action of bringing heat and fluids to an area where healing needs to be accomplished. It does this to dilute wastes that are deposited there and accelerate or speed up their elimination. It's not a mistake. It does not need to be forcibly stopped with drugs. It requires only our cooperation. It requires that we understand the body's reasons for implementing it. It further requires us to simply remove those reasons so then the body can heal itself and resume normal function. This time with pancreatitis, however, invaders are not blamed. The medical theories surrounding pancreatitis are different, and they don't generally involve microorganisms. For this reason, antibiotic treatment in cases of pancreatitis is regarded to be controversial even by mainstream medical authorities. I suspect that that's why the vet told me she hardly ever uses them for pancreatitis. In general, the medical profession is not well known for its dogged determination to find the underlying causes of illness. True to form with pancreatitis, their claims are vague and misdirecting. What they claim essentially is that something causes the pancreas to overproduce the enzymes that normally break down food. These enzymes then begin to destroy the pancreas itself. This, they speculate, is the reason the pancreas becomes inflamed. What's wrong with this theory? Well, firstly, it only sends us looking further upstream for answers. It doesn't solve the riddle. What's the something that causes the overproduction? That's the question we have to answer if we're going to get to the bottom of the problem. Remarkably and revealingly, this is where the medical profession stops investigating. Their solution at this point is to simply stop the body from what it does in response to the something which causes the overproduction. Later in the article, I'll take a look at these solutions that they offer and the additional harm that they cause. So, what are the symptoms of pancreatitis? If you have a pancreatic dog, you already know that they are usually lethargy, lack of appetite, vomiting, diarrhea, abdominal pain, and or swelling, and sometimes fever. As we know, symptoms are either the body eliminating wastes, protecting itself, or compensating for some harmful influence. In the case of chronic disease, which acute pancreatitis is not, it's the result of damage done to the organ in question. Let's look at each of those symptoms of pancreatitis and what they really mean. So the first one is lethargy. And lethargy is the body effectively saying, we don't have enough energy for outward activity today. We're spending all of our energy in here trying to deal with this piled up waste. And there seems also to be a problem getting sugar into our cells in order to produce energy. Take a nap and check with us later. That's the body. That's what the body is saying with lethargy. It's a signal to the dog to relax, conserve energy, and allow that energy to be spent on healing. So to help you understand this, I have to right here tip my hand and reveal the real causes of pancreatitis. If you know anything of natural hygiene, you'll already, or rotational monofeeding, you'll already be aware that accumulated waste is the cause of all disease. It's called toxemia. In the case of pancreatitis, this accumulation is only partially responsible. The other causative factor is dietary fat. I'll get to a full explanation of that later. The next symptom is lack of appetite, sometimes called in vet circles anorexia. It's not anorexia nervosa, it's just anorexia. It means lack of appetite. The last thing a sick dog needs is food. Food is work for the body before it is fuel, and most domestic dogs have several weeks worth of fuel already on their bodies. If you doubt that, there's lots of research out there on the incredible fuel efficiency that is built into every dog's body. You have to look for it because vets don't know it, and it's not commonly taught to vet techs or anybody who studies animal health. This is information that you need to collect on your own. Most dogs listen when they get the signal, and they refuse to eat when their pancreas is inflamed. That's normal. It's natural. That's supposed to happen. It's the body wanting to direct its energy to healing instead of digestion. Most often, they won't even eat the tempting human foods that their owners offer them in desperation, because we humans want our dogs to keep eating. We can't stand it when they stop eating. Speaking of which, it's difficult to overstate how counterproductive it is to attempt to override a dog's lack of appetite. It's like if you have the flu and your mom comes in and begs you to eat a couple cream puffs. You might do it just to please her, or maybe because you think you need food even when you're sick. That's one of the medical industry's favorite lies. You will hear doctors saying that all the time, especially on TV. Oh, you have to eat or you'll get sick. You have to eat or you'll get sick. But your body, if you did that, if you ate the cream puffs, your body would soon tell you the truth, especially if you were sick with pancreatitis. Your mom will have done you no favors, and she'll just have to watch you suffer more. And it's the same thing with our dogs. It is actually cruel to feed a sick dog, especially one that has no appetite. It only guarantees that the sickness will linger and even escalate. So the next symptom is vomiting and diarrhea, which are sort of two ends of the same problem. The body can't process food, so it expends the energy and resources needed to quickly get rid of it. These two symptoms only happen if an owner is foolish enough to feed, and of course, if the dog is foolish enough to eat when they know they have a sick dog on their hands. Domestic dogs sometimes will eat out of habit, even when it requires them to ignore their do not eat signals they're getting from their body. So that's why we have to make the decision for them sometimes. And the next symptom of pancreatitis is abdominal pain and swelling. We already know that the body uses inflammation to bring fluids and heat to the site where healing needs to be accomplished. It's a self-protecting, self-healing process that must happen. It's not supposed to be comfortable. If symptoms were pleasant, there would be nothing motivating anybody to stay healthy. Symptoms are our comeuppance for having done something harmful to ourselves, typically by what we chose to eat. In our dogs, it's the same, but they're paying for our mistakes. The only responsible and compassionate course of action, I will say, is to, one, figure out what we did wrong, two, stop doing that, three, do better from now on, and four, not make the current sickness worse or guarantee recurrence by administering drugs and junky foods. So the next symptom is fever. Just as with inflammation, the body uses heat or energy to accelerate the process of healing and waste elimination. Fever requires a great deal of energy to produce, so it's not seen in all pancreatic dogs. You might know that fever is not seen in adult humans very much because it takes so much energy to produce a fever in the body that it is usually only experienced by children. Lots of kids get fevers, not very many adults do. Fortunately, with regard to fevers, even the medical profession is beginning to understand that fever should not be treated. They've invented a bunch of crazy nonsense that aligns with their other lame theories about disease causation to explain why not. And it's only because treating fever clearly makes illness worse that they are finally starting to back off on their normal advice to bring it down. The bottom line is that fever should not be treated. So let's look at the veterinary solution to pancreatitis. And this is objective information. This is not information you will get from a vet, and it's very often not information that you will get from anybody who is not in the veterinary profession, because not very many people are willing to stand back and look at this information objectively. So the first three drugs that come up as being very popularly administered and recommended by vets in cases of pancreatitis are Cerenia, meropetent, and ondansetron. Not sure about that. These drugs are all antiemetics, which means they stop the body from vomiting. They stop the body from removing food that it cannot use, they force the body to retain food that it can't process. The people who recommend these drugs seem to think that the body is making a mistake when it chooses to rid itself of food that it already has in it that it can't process. It's not a mistake. It's absolutely not a mistake. The body should not be forced to digest food that it is not capable of digesting. There's no way that this could not result in sickness becoming worse. The body always acts in the dog's best interest. It can't do otherwise. But these drugs would not be necessary at all if the dog's not fed, obviously. Unfortunately, vets have a lot of ignorance and unfounded fear around allowing dogs to go without food. So they tell dog owners to feed their dogs, and then the owners must deal with the vomiting and the consequences. And of course, the dogs must continue to suffer. They then give drugs that force the body to retain the food. If food caused the original problem, and all this is being done to ensure that the causes stay in place, is it any wonder that pancreatitis so often becomes chronic? That means it becomes cyclical. It happens over and over. That's when the tissues within the pancreas simply die. They have no choice. They're scarring, and they're simply dead tissues. That means permanent damage, and that means the pancreas can't function the way it should for the rest of the dog's life. And that makes it even more necessary to follow a biologically appropriate, effective diet that does not burden the organs. But in addition to the harm that the digesting of food and the waste it produces will cause, these drugs all have other harmful effects. This is a commonly misunderstood euphemism. The euphemism known as side effects. It's the medical industry's way of convincing you that these effects aren't important or that they're a reasonable trade-off. They aren't. They are simply changed symptoms. Sometimes they are even worse than the original symptoms. It happens all the time. that a person will begin taking a new drug and discover that the side effects are worse than the disease. If that hasn't happened to you, I'm sure you know somebody that that has happened to. So when that happens, people just choose to stop taking the drug and they move on to another drug, or they put up with the original symptom or whatever. Dogs can't do that. They just have to continue to suffer, even if the so-called side effects are worse than the original symptoms. The next drugs that's commonly used in pancreatitis are cyproheptadine and Remeron. These are appetite stimulants. It's, as we've already covered, it's normal for the body to shut down appetite when there's healing to be done. It knows that food caused the problem, and it's trying with all its might to solve the problem. It's nature's wisdom. The vet industry's answer is to stimulate the appetite. These stimulants fool a dog into ignoring his wise body and abusing it with more of the original cause of the pancreatitis. Sometimes the drugs don't work or stop working, and the owners must also resort to very junky, tempting foods to get their dogs to eat. It's a wonder that every dog treated this way does not die once pancreatitis sets in. It's certainly no mystery that it very often becomes chronic and that other organs become affected. We'll talk about the other organs too later on in this article. Tramadol and fentanyl. These are pain medications. Pancreatitis is painful. Of this, there is little doubt. To the extent that we must keep a dog comfortable, it may be necessary to manage pain. However, it's risky to make a dog's discomfort completely go away, because this may cause them to become active and eat or otherwise do behaviors that will not aid the healing process. That's why I recommend starting with something milder and less toxic than pharmaceutical pain meds, if you can. Many factors need to be considered, and it's a very subjective matter trying to ascertain how much pain a dog is in. Since managing pain with pharmaceuticals always causes the original problem to worsen, it is my considered opinion that they should not be used unless the pain is severe. Pharmaceutical pain drugs should definitely not be administered as routinely as they typically are. The people who prescribe these drugs are not properly schooled in the additional harm that serves to offset the benefits, so they tend to see only the benefits, as is the case with much of what they do. In any event, pain management is very situational and requires individual assessment. So let's look at the causes of pancreatitis. And what I'm going to do is go through a bunch of bullet points here that show the various theories that are posited by the veterinary industry. And then after each one, I will unravel it for you. So the first thing that they theorize causes pancreatitis is eating something with a high fat content, particularly if it is not part of the regular diet. And I say there's no doubt that dietary fat is the primary cause of pancreatitis. Even vets know and acknowledge this obvious fact. Everybody knows now that pancreatitis is caused by fat. Absolutely. The second thing that is postulated is being overweight. But being overweight is not a cause of any disease. Pancreatitis and the state of being overweight are two coexistent effects of the same underlying problem. The problem is dietary excesses. Of course, the problem is always diet. Pancreatic infections are said to be a cause, but this kind of diagnosis typically signifies that either a microbe has been found at the site of the inflammation or it's suspected to be there. It is speculated that this microbe brought or caused the problem. But this is akin to blaming garbage on flies, stagnant water on mosquitoes, and fires on firemen. Bacteria do not bring disease. When they show up, they are actually manufactured by the DNA in the body to help clean up waste that are interfering with healing. It is the bacteria's job to consume or break down morbid matter. That's why they reliably show up at the site of inflammation right on cue to serve as industry's favorite scapegoat. It solves absolutely nothing to kill or neutralize them. This only forces the body to stop its own healing process. The inflammation may stop, but the underlying problem has not been solved, and it's only guaranteed to recur. This is how pancreatitis becomes cyclical or chronic. And it also becomes a guarantee of future income for vets, and that's related, of course. The next theorized cause is having other medical conditions like Cushing's disease, diabetes, mellitus, or abnormally high levels of fat in the blood. The conditions, once again, do not cause each other. They just lie up or downstream of each other, and they occur concurrently. To blame one disease on another is to completely misunderstand the concept of underlying cause. It's absolutely true that an abnormally high level of fat in the blood can cause pancreatitis. But what the VCA doesn't tell us is that it's usually because a dog owner is feeding exactly what the vet industry recommends or some homemade replica. There's a reason why there's a high level of fat in the blood, and we can do something about that. But the VCA is not going to tell us that. They're just going to tell us that high levels of fat in the blood can cause pancreatitis. They might even try to sell us some low-fat dog food, but we'll talk more about that a little later in this article. Another theorized cause is exposure to some types of medications or toxins. Yes, drugs can damage the pancreas. This is often not considered by the people prescribing and recommending these drugs. Unfortunately, when these drugs are administered and recommended, the person doing that they're just intending to suppress the original symptom, and they think that it's worth it to cause damage to the other organs. When an initial symptom needs to be suppressed, like phenobarbital or steroids, they will acknowledge that these drugs cause organ damage, but they think that it's worth it to administer phenobarbital in cases of seizures or steroids in cases of inflammation or skin problems or whatever they administer them for. Next theorized cause is abdominal trauma that affects the pancreas. Damage caused by trauma to the pancreas is certainly a possibility. However, it is known that the most common cause of pancreatitis is fat. And with the excessive amounts of fat typically being fed to dogs, trauma must account for a very tiny percentage of pancreatitis cases. And the next one is a genetic or breed disposition. Breeding definitely does contribute to dogs having mispositioned organs, faulty morphology, and abnormal function. There's no doubt about that. This can certainly account for where disease happens in dogs. It's not a sole cause for disease, ever. Otherwise, the dog would have the disease in infancy, and they don't. They typically have it much later in life. Genetics can never solely determine whether disease will happen at all. Here, a bit of an explanation about genetics would be helpful. Genetics has been presented as a primary cause of disease by the medical profession because it allows them to avoid investigating real causes. The burgeoning field of genetics is a dead end from a practical standpoint, but an absolutely bottomless pot of gold for the research community. The money keeps flowing, and the promises of cures right around the corner keep making the headlines. It's a very easy sell because everyone wants to think that the answer to all disease will one day come out of a lab. So taxpayers are happy to foot the bill for all of this important and promising research. And genetics is a very appealing potential answer to the problem of disease. What's not to love about being able to blame your diseases on the errant genes your ancestors passed down to you? The truth, however, is that genes have no power to cause disease. If they did, every chronic disease that is attributed to them would occur in infancy. Instead, chronic disease typically occurs after a lifetime of self-abuse in the case of humans, or in the case of dogs, misfeeding by us. humans. We have the power within us to prevent disease in both ourselves and our dogs. And where pancreatitis is concerned, we have the ability to get out of the body's way and allow it to resolve the problem once and for all. Next possible cause, a history of pancreatitis. A pancreas damaged from previous dietary mistakes is in even more need of proper feeding. In most cases, even dogs with a previous history of chronic pancreatitis can remain symptom-free if they are fed properly. It's very important for those dogs. In many cases, no specific underlying cause can be identified, they say. But it really doesn't matter what the veterinary industry were to claim as a cause anyway. That's because their causes and their consequent solutions always leave us back at the beginning with a bunch of original symptoms and side effects, so-called side effects to deal with. So now let's talk about the real causes of pancreatitis. This is the reality. I recently heard that there's a new theory floating around about pancreatitis causation. And of course, like everything else bad in the world, especially of health, pancreatitis is now being blamed on carbs. Carbs are the scourge of the earth now, suddenly, right? Since the pancreas is involved in sugar metabolism, which it is, not fat metabolism, it is claimed that carbs are the culprits. While this might seem plausible because of the pancreas's inherent function, it's definitely not the case that pancreatitis is caused by carbs. Pancreatitis is caused by fat, and here's why. When fats are overeaten, their abundant presence in the bloodstream inhibits the uptake of sugar into the cells. To compensate, the pancreas works really hard producing more enzymes that normally accompany sugars, which unlock the cell receptor and allow the sugar to be taken in by the cell. The overworking that the pancreas does greatly taxes it. The body attempts to assist by bringing energy, heat, fluids, and other bodily resources like white blood cells to the overworked organ. This is inflammation. This is pancreatitis. Pancreatitis is the acute phase in the development of pathology that later manifests chronically as diabetes. Pancreatitis is when the pancreas is still able to overwork itself into an inflamed state. Diabetes happens later when the pancreas is exhausted and no longer able to produce sufficient enzymes like insulin at all. Pancreatitis is acute. Diabetes is chronic. They are 2 points along the same disease development timeline. But that's not to say that diabetes is always preceded by pancreatitis. Irritation or inflammation of the pancreas can occur at a lower severity that does not even motivate a vet visit or a diagnosis. If it occurs repeatedly and sufficiently to wear out the pancreas, it will set the stage for chronic disease. This is especially true in certain breeds that are said to be predisposed to sugar metabolism disorders. In any dog, however, diabetes can happen without the dog ever having been known to suffer pancreatitis. So now let's talk about removal of cause. When we know what the causes are, doesn't the way forward seem clearer? If you can figure out what you did wrong to create your disease or your dog's disease, you can fix it. And by rights, you are the only one who can. The body heals itself. That's precisely what the medical world does not want you doing. They would go out of business if you did that. Is raw feeding the answer? Many people will tell you that feeding your pancreatic dog a raw food diet will solve the problem. If you think that, go join some of the raw feeding groups on Facebook and see how many owners still complain about pancreatitis symptoms in their dogs. There's a lot. Raw feeding alone is not enough to solve the problem, particularly if the owner chooses one of the commercial raw frozen foods. These foods contain far too much fat for a pancreatic dog, or any dog for that matter. Below, I've listed, I've compiled a list of 5 very popular raw frozen dog foods just to show you the fat content in each of these. It shows fat content by weight versus calorie. The guaranteed analysis percentage shown as crude fat that you always see on dog food labels is calculated on weight. Since fat weighs much less than protein, this can make the fat percentage look very low. So it's intentional. They want you to think there's very little fat in there, but it's actually mostly fat. In reality, what's important is the percentage of the food represented by fat calories, not weight. That's why the caloric calculation is almost never provided on dog food labels. So take a look at these numbers. There's one called Raw Wild, and the fat content shown on the label is 10%. In reality, it's 57%. Primal Raw shows as 7% on the label. It's actually 56% fat. A brand called Instinct Frozen Raw, it shows as 8% on the label. It's actually 50% fat. Small Batch Frozen Raw shows as 8% on the label. It's actually 52% by calorie. And Northwest Naturals is 8% on the label, but actually 52% fat by calorie. So obviously there's a problem here. Fat is what dog food producers love to hide. Their products all contain too much of it, and they know it. If they didn't know it, why would they go to so much trouble to hide it from you? Fat is cheap and abundant. It serves the same purpose in dog food that grains used to before factory farming, because factory farming makes agricultural animal waste products so cheap. That's what is used for dog food. Fat, animal fat, has become the filler ingredient that grains used to be. And it's hidden. It's mostly hidden because they don't have to tell you. They don't have to reveal to you how much fat is in their products. They can lie to you about that. So what about dried, canned, or freeze-dried foods? If you're thinking that commercial raw food contains more fat than the dry, canned, or freeze-dried versions, you're wrong. The commercial raw grinds that we just talked about are typical of all dog foods with respect to fat content. So if you don't believe me, go to a site called Dog Food Advisor and just put in the food that you're currently feeding. They have most of them on there. There's so many new foods coming onto the market. Every day there's a different food coming onto the market, but they do have most of the popular ones on there. And if you do that, by the way, don't pay any attention to the ratings that they give foods because they aren't aware of the hazards of feeding commercial foods to dogs. Their ratings are all within the context of commercial food. It's like comparing one bad commercial food to another. It's really not difficult to be a standout when the competition is so abysmal, and it truly is. So when you see the breakdown of your food there, with regard to fat content, if your dog has pancreatitis, you'll know why. So what about, let's talk about the low-fat commercial dog foods, and I have one here that I'm going to analyze for you that is recommended by vets when your dog presents to a vet with pancreatitis. In response to all the problems that really high-fat dog foods cause, some brands have offered what they call low-fat foods. Hill's Prescription ID is one of the most popular brands. So here's a breakdown of the guaranteed analysis versus percentage of macronutrients by calorie. Macronutrients are fat, carbohydrate, and protein. There's only 3 of them. Macro means big. In Hill's Prescription ID on the label, it says 15% fat. It's actually not 15%. It's 32% fat by calorie. So what they've done here is, over here is the carb on the right is the carb category. What they have done in order to displace some of the fat here, to replace it, they've just added sugars. They've added carbs, and the protein is actually lower. The protein is actually fairly low. But, there's a price to be paid for this low fat, and it's really not that low, but it's probably acceptable at 32%. But there are lots of other problems with this food. If you know anything about this brand, Hill's Prescription, It's awful. It's absolutely an awful brand. And really the only thing that Hills has going for it out there in the marketplace is their brilliant decision to use vets to market their products, because that's what has made them so successful. That and probably endowments to the veterinary schools. Um, but it's impossible for Hills to create a low-fat food the correct way, the biologically appropriate way, because this would require them to use much more of the most expensive ingredient, lean protein, and much less of the cheap ones, fat and carbohydrate. So instead of doing that, they do what dog food producers used to do. They use grains, they use carbohydrates. This is the ingredients list: brewer's rice, whole grain corn, chicken meal, pea protein, egg product, pork fat, corn gluten meal, chicken liver flavor, dried beet pulp, lactic acid, pork liver flavor, and soybean oil. The list is actually longer, but the remaining ingredients are only synthetic nutritional supplements. A pancreas that's in trouble might get a break with this kind of food for a while because it doesn't have the thing that really overworks the pancreas. It doesn't have a lot of fat. But these other ingredients in this food are going to cause disease in the dog's body. Brewer's rice, for example, is a waste product of the rice industry. It is floor sweepings and vat scrapings, in other words. Even if it wasn't, rice is entirely inappropriate for dogs. Corn that is grown for agricultural purposes is extremely starchy. The kind of corn that is used in dog food is called field corn. It's not even palatable by humans because it's very high starch content. I have tasted field corn right out of the field, and it's awful. You can't even chew it. You just want to spit it out of your mouth. It's so starchy. Chicken meal, which is on the list, is an extremely overprocessed brown powder made from slaughterhouse waste. This is a photo. Take a look at this photo. I had to do a lot of searching to find this photo, but look at that pile of brown powder. Does that look like something you would eat or something that you would knowingly feed to your dog? I certainly wouldn't want my dog eating that stuff. So I don't think I really need to go on here with the ingredients. I don't know personally where the idea came from. Well, I suspect where it came from. It came from industry, that dogs are so adaptable that they can live healthfully on these ingredients. If it was possible to design a shelf-stable, cereal-like product that would provide complete nourishment healthfully, cradle to grave, wouldn't we have put something like that together for humans? Just imagine the time that you would have available as a parent if you didn't have to shop for, schlep, and prep all that wholesome homemade food that we're supposed to be feeding to our families. Or maybe we could just put everything in a handy little capsule that the kids could take with their Slurpees. Convenience is everything, right? I mean, that's what we've been told by industry. You don't want to home feed. Number one, it's risky, and number two, it's so inconvenient. Well, is that important? Is convenience so important? Why do we think it's so important? Well, I think it's because industry has planted that idea in our heads. I personally am as short of time as anybody else, but I certainly don't put convenience at the top of my list when deciding how to feed my dog. My dog means more to me than that. So the question might arise in your mind, if commercial pet foods are out, including raw ones, what's the answer? Well, raw meat and bones should definitely form a significant portion of a dog's diet. There's no question about that. But if the diet is meat-centered and commercially produced, it is almost guaranteed to contain too much fat for a pancreatic dog. Any dog fed these fatty foods on a long-term basis at the risk of pancreatitis and many other diseases. If your dog has already been diagnosed with pancreatitis at any time, you're definitely going to want to avoid them completely. So RMF, rotational monofeeding, is a perfect diet for the pancreatic dog. There is every reason for the owner of a pancreatic dog to expect the same excellent outcome my sister had with her dog Rhodey. Whatever previous damage has been done to the pancreas by a fat-laden diet can only be healed if the causes of the original damage are eliminated completely. The body has amazing powers of self-repair when it's given full rein. And if there is permanent damage, this is really important to understand this. If there is permanent damage, there is no remedy and no medicine on earth that will resolve it. All that can be done is to avoid overburdening that compromised organ in the future. That's very important. To do that, an owner must make sure that the diet is clean, first and foremost. And by clean, I do not mean organic, free range, locally sourced, or any of those other meaningless concepts that allow dog food producers to lure consumers. I mean fully, cleanly digestible. That means primarily foods that dogs have eaten throughout their long history on this planet. The foods we still see them eating in the wild. Those are the foods that form the basis of rotational monofeeding. Waste from the animal agriculture industry is what primarily forms the pool from which pet food producers acquire their raw materials. That's why we have to be sensitive to the fat issue. The fats in commercial dog food are as prevalent and difficult to avoid as refined sugar is in foods aimed at children. It's just very ubiquitous. It's everywhere. The only solution is to stop buying commercially processed food products altogether for your dog, like health-minded parents are having to do for their children. The pancreas is not the only organ that is harmed by overconsumption of animal fats. Whether your dog has had problems with his pancreas or not, you can save yourself a lot of heartache and your dog a lot of suffering by learning how to properly home feed him. It's not as difficult, it's not as expensive or complicated as you've been led to believe. Dogs need real food, the same kind of food that you can buy in the same stores where you buy your own food. So that's the end of the article. I hope you guys learned a lot from it. And if you haven't ever heard of rotational monofeeding before, I hope you'll visit the website. It's called rotationalmonofeeding.com, and there is a link in the description box. And that's all I have for now. Thank you for watching, everyone. See you next time.